Hey, everybody. Welcome to our November 2020 version of Healthy Happy Hour. We got a good one for you this week, we got a good one for you this month. Remember that we have Healthy Happy Hour every third Thursday of every month, and our mission is to bring you a plethora of health information from many different angles, many different viewpoints to be able to give you as much information as possible to be healthy, happy, and fulfilled. Um, Remember, you can visit our website at www.neighborhoodmedicalcenter.org to learn more about Neighborhood Medical Center. If you can see my background, that is our new podcast for Neighborhood Medical Center, which is called Mind Your Body and Soul, which you can catch every Wednesday at www.nmcpodcast.com. So I just want to get that out the way and let you know some of the great things that we got going on at Neighborhood. And remember, like I said, every third Thursday, you get your healthy happy hour. So this month, we wanted to do something different. We wanted to go in a different direction as far as our healthy happy hours, a topic or an aspect of healthcare that many people need and many people call on all day, every day, but a lot of times it's not talked about in a practical manner as far as in the as a piece of the realm of health. But that's why we like to think outside the box so we can bring you different things that we know is important to you. So today we're concentrating on information technology within healthcare, and we have a gentleman who is the chief information officer for Neighborhood Medical Center. So I want to introduce and welcome y'all, Mr. Mark Leonard. What's going on, Mark?
What's going on, Joe? Thank you for that introduction, man.
I don't know, man.
Good to be here.
Appreciate you, man. Appreciate you giving your time and giving us some of this information on information and technology. Because, like I said, a lot of times we don't realize how important you guys' role is until you're not around and you can't figure out how to do stuff.
Right.
But also, it goes deeper than that because you guys deal with a lot of the information, like the critical information that goes in running healthcare from a business aspect and from a, I guess you could say, a legal aspect, from an aspect of different just things that organizations put in place to keep structure. So I'm gonna shut my mouth and go ahead and give you the floor and let you do your thing.
All right. Well, thank you, Joe. Like I said, thanks again for that introduction. And yeah, you're right. A lot of times, with the healthcare providers and all the other support staff that goes into taking care of patients, a lot of times people do forget about what makes everything run in the background, and that's usually your IT folks. And for those who have worked in healthcare, they know, like, if something goes down and the IT is not around, that could shut down everything that's going on with the clinic. Patient can't get care. You can't get information that you need to take care of the patients. It's a big deal. So, like I said, again, I appreciate you letting me come on to kind of talk about some of the things that don't really get discussed a lot, but we're very important in the background to make things happen on a daily basis.
Right.
All right. So today, just before we get into everything, I want to just draw attention to one key word that most people say it. I'm not sure if everybody knows what it is, but that one word is HIPAA. Um, so in the process of us going about our daily tasks and taking care of patients in the healthcare realm, one of the most important things is HIPAA, and what that is the Health Insurance Portability and Accountability Act. So, in turn, what that is it was an act that was created as a U.S. law designed to provide privacy standards to protect protected health information, and that is the the start and the finish of what's at stake when you're dealing in healthcare. You really have to take care of this protected health information, because if not, You're looking at penalties, fines, things that can really shut a healthcare facility down. So just to give a brief history on HIPAA, it was developed by the Department of Health and Human Services, just to make sure that patients are provided with access to their medical records, and that information, like I said before, is protected. Um, there have been many changes, upgrades to it since it was first created, and which with the standard, the the constant changes of technology and upgrades, of course, you would have to update, the laws that go with that. So, um, like I said, it's very important to make sure that health information is protected. So, the reason I wanted to lead with that is because health health and IT, when they go hand in hand, all of that is at stake. So now we're trying to merge at this point, 2020. We're trying to make sure you can get all the information that you can get, but in turn, what that means is you're trying to merge these, different systems to talk to each other. But the main goal in that is to make sure that that health information is being protected. If not protecting the health information, then you're going to get a breach. You get a breach, you get a fine, and you get a fine. It just depends on what kind of fine you get, because you can get fined for each piece of information that is leaked in a breach. So that could shut a whole facility or enterprise down. Hospitals and that are included as well. Um, so HIPAA does have 5 titles, um, and Title One is just healthcare access, portability, and renewability. Um, and that pretty much just lays it out where employers and health plans must allow new employees medical insurance coverage to remain continuous, without regard to pre-existing conditions. So you can't just deny somebody, healthcare because they have a pre-existing um, condition. And the second title, and I'm just going to kind of go through these just so you know the titles, is Preventing Healthcare Fraud and Abuse, Administrative Simplification, Medical Liability Reform. That's just the second title. And Title Three is just tax-related health provisions. Just kind of standardizes the amount that you can save per person, in medical savings. And the fourth title is Application and Enforcement of Group Health Plan Requirements. Um, just broaden information on insurance reform, provisions, and provide detailed explanations on that. And Title Five is just revenue offsets. So pretty much our regulations on how employers can conduct company-owned life insurance premiums for income tax purposes. And all of those titles just go together in that rule. Um, so with HIPAA, like I said, it's there to provide access, and it's also there to protect your health information. So, and right now in healthcare, it's all about, in technology and healthcare, it's all about results. You want everything at the tip of your fingers. You want everything to kind of work together. And when you're doing that, you just have to make sure that you're getting, and I'm talking from a patient's perspective on this. So you want to make sure that whenever you go to the doctor or you get labs done, you have the right to have access to your records. You have the right to make sure that it's protected. Um, and that right comes with whoever your healthcare facility is. Most at this point have EMRs, that's an electronic medical health record system. So it's pretty much back in the day, everybody had their health records, or they kept health records like on a server, or that's more of the old school way. At this point, it's in the cloud, just like everything else is. So with it being in the cloud, of course, it has to be protected. But one of the biggest gains of it being in the cloud at this point is having a patient portal. So with the patient portal, a lot of times I notice, well, and it kind of depends on the kind of the age of the patient, or how comfortable they are with IT or information technology, um, whether they access the portal. But one of the biggest gains of that is you have all of your information. If you had a question about some lab that you had, or if you go to a different doctor, if you have access to that portal, you know everything that's going on with your health. So I advise everybody to take advantage of accessing your, health record. Go ahead and sign up for the patient portal. Um, like I say, most facilities, they have them, and most of them should offer them to you. But if they don't, just ask. Just say, hey, do you have a patient portal where you can ask your provider questions, you can ask your provider staff questions. You may be able to set up an appointment, or you may just be able to request an appointment. But either way, you have that at the tip of your fingers to help guide you through, um, your health, and getting what you need from that. Next, as we were talking about HIPAA, there are some key identifiers for HIPAA, and most people know, with the protected health information, um, of course, numbers, fax numbers, email address, anything can be identifiable to somebody on the outside of that patient. So if somebody can see that information and know who it goes to, that's protected health information that should always be protected. Now, and this is something that not a lot of people kind of go by or do, but this is one of the identifiers that it doesn't really get talked about, but it is a form of protected health information, is the patient chart, or the patient ID. Now, you can see this patient ID and not know who that who is referring to, but that is a part of an identifier. And that was something that I recently learned, I think about 2 years ago. Now, for those people that may be watching this and they work in the IT realm, or even if you just work in a healthcare facility, it is okay to use, if you're sending emails, it's okay to use that patient ID when you're sending in an email, but just make sure that the connectors in between, when your email gets from point A to point B, your traffic is encrypted. And you can also have several layers of encryption, or you can have one layer of encryption. We have a couple, but like I said, you just want to make sure that that health information is kept safe. So like I was saying, with the patient portal, just make sure that you're tapping into the resources that are there. The patient portal, like I said, I use the patient portal. I know several other staff, they use the patient portal, and a lot of patients do use it. But for a caretaker, or helping somebody in your family with their health, make sure you ask about the patient portal and how you can get access to it, or help that person get access to it to further you along. So right now, as everybody know, we're in the midst of a pandemic. Offices are trying to limit how many people come in the clinic at this point. So that means that phone lines are really, really busy. So one of the things that we know that helps is when patients actually access and use the patient portal, you don't have to sit on the phone lines. You can just put in your request and you give us 24 to 48 hours. And a lot of times it can be done way before that. But you can have that done without even sitting there getting frustrated, waiting on somebody to pick up the phone. And like I said, you can request appointments, you can send messages, and you can also pay your bill. So those are just some of the things, that you should really take advantage of when it comes to your health. As far as, seeing your health history, just take advantage of it. And before we get to the questions, I just want to talk about some of the more, some other things that have come up, especially during the pandemic, with just new methods on how to, get visits at the doctor. And, as I mentioned, the patient portal, but also right now, as everybody has heard, telehealth is one of the biggest, one of the most important services right now, for those that may be having symptoms, COVID symptoms, or may even have COVID. And you can't, right now you have to be safe. So you can't just let everybody in the clinic right now. But for those that can't come in, or it could even be just transportation. Maybe you have a transportation issue, but that's one of those things telehealth brings to the table, where it allows you can do your appointment anywhere. You can do your appointment in your car. You can do your appointment from work on your lunch break. You don't have to take off work. For kids, instead of, you can maybe just you can go pick up your kid. Y'all can maybe have lunch in the car. Probably do that telehealth appointment in the car, and then they can go back to school without them missing a whole day of school, how it was before. So telehealth is out there. It's available. Neighborhood medical center. We've been doing it before the pandemic hit, but we're grateful that we did, because we're ahead of the curve. So just make sure, because a lot of healthcare providers are offering that. So if that's something that you need, make sure that you request it, because it could be there that you just hadn't heard about it. And that greatly helps with what we're going through right now in 2020. So, so you have any questions?
Yeah. First of all, I appreciate that information. I appreciate how you was able to connect, like, how cloud-based systems are being used. So with that being said, like you was talking about the encryptions and how a lot of information is stored on clouds these days as opposed to back in the day. So how, just for like the novice or somebody who may have watched something that saw some hackers or something or whatever, just for like those left field questions,
Mm-hmm.
how efficient is HIPAA in being able to protect or even track down those who have been able to breach some of those systems?
All right. So HIPAA, so like I said, HIPAA is just more of the act. So that's something that we have to abide by. So you have different agencies. So with us, federally qualified health center. So you have like OCR. So they're like, well, you have different ones, but for us, like I said, you have OCR, where they kind of regulate. So if you have a breach, that has to be reported. So it has to be reported to the governing agencies. You report that. Now, the ways to protect yourself, you can have like liability insurance. You can have insurance for data breaches, and you can have that type of insurance. Or you can have a third party company that helps with those type of things. Now, with some of the recent ransomware attacks, they get into your system, they lock down all your files, and you can't get it until you pay them $1 million, $2 million, or even more, just depending on how much information they took. some companies, if you have, if you have good backups, on site and off site, um, you're in a better position because although they have that data, you're able to get your processes running again. Now, the bad thing about them getting your data is because they can publish it.
Right.
So, right. They can sell it, they can publish it, which still will be investigated, and you can still end up with fines just depending on how that information was leaked. Um, so yeah, so with the encryption part of it, that's something that just needs to be set up. Your IT needs to make sure that you're set up end to end with encryption, and most of especially the email, like if you have Microsoft Office 365, they come with a lot of the rules and settings that you need.
Okay.
Now, when you're dealing with, I know some companies like to use Gmail, Yahoo for their business, and they have business solutions for that. Or if you have someone on your staff that has a good knowledge of it, they can harden your network, so you'll be okay.
So basically, you saying as far as email, because this is going to lead into another question I have about email. But as far as what you're saying now, using emails that are designed for businesses give you more protection than an email that you are just using for business.
Right, because you can set those protocols to make sure you have encryption. I'll give up one of my secrets. So one of the things that a lot of our staff don't know is that our emails are already encrypted. So I do a dual layer. I require everybody to do a second layer of encryption, but even if somebody does send some type of patient information out, it's already encrypted. So that's just one of those things. You just have to think about that moving forward because nothing is going to be 100% at all times. So you have to have those safeguards in place.
I got you. So this next question is about, as you were talking about the encryption of the emails, you made me think about one of the mandatory trainings that we had to take for neighborhood, and it was going over email phishing.
Yeah.
And I was saying if you could kind of, I know it worked best with those actual pictures of the email examples, but kind of give people some information on what to look out for as far as when it comes to email phishing. And because like for my personal email, somebody keep trying to get me through Netflix. And it's like they got the Netflix logos and all that, but the email is something crazy. But like they'll send something. I go to Netflix and I look at my account and whatever is saying in my account on Netflix ain't saying what they're saying in the email. And I think somebody trying to do me like that through PayPal as well. So like for somebody who may not have gone through that training, they see a Netflix or a PayPal or whatever reputable business email come through, but it's actually a phishing email. What should they be looking for to help protect themselves?
Okay, so just to kind of lay out what phishing is. So phishing is almost what it sounds like, but it's spelled with a PH instead. So phishing is when somebody sends you an email or some type of correspondence and they put malicious files or they put links just for you to click on, and that's how they either get into your system, they get your credentials so they can go back and log into some type of system that you have, or sometimes they just save the information that they pick up and they might not even log into it, they just sell it to someone else. So what you should be looking for during like a phishing attack, matter of fact, even whenever you're in your emails and you get, and a lot of times they do look legitimate, just like Joe said. It could have like a Netflix logo. It could have a Microsoft Office 365. It's time for you to change your password. It could be Publix, to click this coupon for free cupcakes, something like that. So what happens is if you just take your mouse and kind of hover over that link that they send to you, you'll see if it came from Publix, or if it's really Microsoft Office 365, or if it's, Netflix. Like if you hover your mouse over it and it doesn't say at the end of a Netflix link, if it doesn't say like netflix.com or whatever Netflix domain is, then it's not real. It's going to take you somewhere else, and it's going to try to make you enter more information. And once you enter enough information, it's going to try to either put a worm in your system or try to just save your credentials. And that's pretty much what phishing is. And phishing is one of the most common types of breaches that happen because it's so easy. You send a link out to somebody, and people want free stuff, so they click. And once they click, it might say, "Hey, well, give me your date of birth," or some people even go ahead and ask for the social, which is a lot of times what they really want. And most of the time people don't do it, but sometimes they do. They put that information in, and then later on you have bills in your name, or you have, your credit has been, somebody has put something on your credit, or like I said, even further, if it's at the job, they're in your system and they have taken some very important records, and then they want to ransom you for
Okay. Yeah, I appreciate that because, like I say, it's a lot of that happening now, and
them. Yeah.
I get a lot. You get a lot of these crazy emails along with these other scamming things, but once again, that's why information technology is important, because you don't want to be vulnerable in this age of technology. So, as far as technology, what and technology and healthcare moving forward, what do we have to look forward to? Because I know we already talked about telehealth, but are there any new things that are coming down the pipeline that could help enhance any technological things coming down that can help enhance healthcare that we should be looking out for?
Yeah. So actually, one of the biggest things, and this is something that has been, we have forms of it now, and they're trying to get to the point where this is something that can be spread all over. It's called the Health Information Exchange, or HIE.
Okay.
And what that is where you have several systems that are able to link together and talk. So a patient can be seen in Miami, and they can come to Tallahassee, and no matter where they are, you can see that patient's history. You can see what medications they've had. You can see how many times they've gone to the ER. You can see all of that information in one place, no matter where they go, which helps take better care of, that patient. That's one of the biggest things that they're trying to work on. Like I said, you have small little circuits of it, but
Mhm.
it's not at the point where it's, worldwide, or,
Right.
nationwide. So that's one of the things that I'm really looking forward to, because that's just going to really help, take care of the patients that come in, and also for myself. So if anything happens, no matter where I go, they have access to my records if something was to happen to me, and they can take better care of me. So that's one of those things that I'm really looking forward to, and that's one of those things coming down the pipe soon.
That's cool. That will be fairly easier and make more sense, especially with it linking different systems, because different agencies use different systems to log
Exactly.
information, track things. So you might be in this one with this name, somebody in this one with this name. You trying to do this, and you have to go here just to go right back there. So that
Exactly.
will be pretty cool. And what's the name of it again?
Health information exchange.
Health information exchange. All right. Well, we learned something. Well, we learned a couple new things here today, but that's what's up.
Yeah.
I don't think anybody else have any other questions. If you do have questions and you're watching, type the question in the chat so we can answer your question. If there are any questions you have, hopefully um, we've covered a lot of the information and answered some questions that you've already had. If not, man, we'll do it again. We could bring this thing back. Like I said, every third Thursday of every month, we're here with our Healthy Happy Hour. and we're making sure that we give people the information that they need from different angles, from different areas of the health realm. Remember, every Wednesday, your favorite podcast, your newest favorite podcast, Mind Your Body and Soul, the Healthy Podcast, hosted by myself, Joseph Ward, and Mathias Sweet. Mathias Sweet is the director of the Ryan White program at Neighborhood Medical Center and the outreach specialist. And we got some good things coming up. So get used to seeing Mr. Mark Leonard. Of course, you're going to get used to seeing our partner in crime, Ian Costello, because we are bringing some men's health information and podcast to you these next couple Wednesdays that we drop our podcast. So be on the lookout for that. We do have this upcoming Monday, we do have a rapid COVID testing site at the Southside Library from 4 to 7. So make sure you come out there. If you need to get tested, come to the Southside Library on South Adams. I can't think of the real name of it, but it's the library right across the street from the post office on South Adams. From 4 to 7 on Monday, we're doing free COVID testing. So make sure you come out and check us out. And make sure you stay tuned for all the free food distributions and things that we have. So with that being said, once again, Mark, I appreciate you, my brother. Gave a lot of good information. Definitely learned some things. I saw you present that before, and I knew some HIPAA things, but I learned some new things. So that's one of the reasons why we do this. And look forward to definitely these podcasts we have coming up and have you back on here for Healthy Happy Hour in the future. So with that being said, we out of here. See y'all next time.
Thank you.
All right.